Thanks for joining. We'll start in 1 minute at 2 p.m. Eastern. Welcome, everyone. Thank you so much for joining. And if you are joining live here today, an extra special thank you for your time. If something comes up and if you're joining us at a later date, just know obviously that you'll be getting this recording tomorrow so that you don't have to take notes today and you'll get all the information and the slides. And if you have any questions that come up during the live, please pop them into the question box. I'm running the whole show here, so I'll do my best to answer them at the same time, but certainly when we get to the Q&A. And then if you have a question that comes up afterwards, if you're watching at a better time for you, please just email me, ashley@thebetternutritionprogram.com, and I will answer it there. So today's topic, I think, couldn't be any more timely. I was just reading an article from the New York Times about just how our food is, and our food as a health issue or as a health solution is just not being served up in the way that it can and it should be. And that puts us healthcare professionals just in the spotlight, especially in a country and at a time where healthcare solutions are either not available or financially challenging. We have this real opportunity. Ashley, is there somewhere I can find the slides for this in PDF form? I will be sending you, that's a great request. I am happy to send the slides as a PDF. I think I just have to download them separately. So I'll write a note to myself to do that. I would expect to get them in your email then tomorrow, Ashley. Okay. And great name, by the way. All right, so for those of you who have not met me or this is our first time meeting, my name is Ashley Koff. I'm a registered dietitian. I've been a dietitian for about 20 years. I am fortunate to be in Columbus, Ohio, and I am also the CEO of the Better Nutrition Program. And over the course of those 20 years, I have really honed in on outcomes. Like all of you, I got involved in becoming a dietitian, healthcare provider, because I wanted to help people get and stay healthy. And what we're going to talk about today is how we can actually do that for 50% of Americans. And that is a percentage that is consistently on the rise, very disappointingly. So there's so much work that we can be doing in heart health. And most importantly, there's so much work that we can be doing that is specific to your areas of expertise. And that's what I want to hone in on, give you the tools and have that discussion. I want to acknowledge something right up front as we move into the slides. And that is that when I started off doing this, I was going to provide 2 case studies. I ran through the timing and it was going to take me over 60 minutes. And I said, I can't do that to anyone. So we're down to 1 very thorough case study, and I'm going to make some other comments as we go through on that part. Where we are today, America is brokenhearted. We're going to look at the statistics, which I don't need to repeat in depth for most of you. And then we're going to talk about what a healthy heart needs. The answer there is not a statin. It could be a statin, could be part of it at times. But we're going to also want to look at how do we know if someone's heart is getting what it needs to run better. We're going to talk about things like labs and biometrics. And we're also going to look at and focus in on how you can use better nutrition assessment tools to do that. We're then going to conclude with how doing this is better business for you. And I'm going to give you some very specific guidance on how you can market yourself as a person who provides these assessments, as somebody who runs these programs, and all doing so within your scope of practice. If you have any questions as we're going along, again, please drop them into the question box for me. Okay. The stats are not good. We have, about half of our country is dealing with, so millions and millions of people are dealing with heart and blood vessel diseases. Now, this is really interesting because the place where it is really good news is if you're in the business of creating medications, and even in certain spaces, supplements, right? If you have something that is considered a diagnostic tool for addressing heart disease. But we all have that tool. Our skills are that tool. And I want to make sure that we are actually doing that and able to help these individuals, because despite those pharmacological solutions, we are not seeing these numbers changes. Now, something that's really important, because when we look at and when the stats around statins are presented, these numbers are talked about. 50% of Americans, right? Oh, this is so important. But high blood pressure is a significant portion of this. So one of the things that we want to make sure that we understand is how are we addressing blood pressure and not just looking at cholesterol and and arterial plaque, obviously that being a component. Cardiovascular disease remains the leading cause of death. And we also know that about every 40 seconds, an American will have an MI. The average age of these is 65 years old for men and in the 70s for women. This is also really, really important, because it's not that these things start to happen in our 60s and 70s. It's that by that time, the old car analogy is worn out, and that is when these things occur typically, but it's been a buildup of behaviors. And we're also seeing these numbers occur earlier, right? Earlier onsets of myocardial infarction and high blood pressure and some of these other things. So we need to be working on the prevention space. I know you guys know all of this. I'm just gonna point it out and do my due diligence to make sure everyone knows I have the science and the statistics included in here, right? So also really important for us to understand that with coronary events, a lot of them are recurrent. So one of the areas of opportunity for us is to work in how do we help prevent a recurrence. The other thing is to understand that heart failure is on the rise, and heart failure being multifactorial. So we really want to pay attention to what is the underlying best treatment protocol. And then also obviously paying attention to stroke. And the reason I point out stroke and I talk about blood pressure is we're going to talk a lot about minerals and their overall role in this, because we spent a lot of time throughout history addressing vitamins and their role in our health, but we need to pay attention, like fat, we also need to pay attention to minerals. Okay, so I'm sorry, this really wants to jump ahead quickly. I might be doing a bit of that today. Better not perfect. So what's actually increasing, or what are the risk factors? And what we know for cardiovascular disease is that the risk factors are behaviors, and they're multifactorial. So 29%, what is 29%? And I'd also like to point out that genetics is nowhere listed on here, right? And we all know, and we're going to talk about the importance of genetics in here today. But look at all of these different ones. And then when we say that statins are the primary intervention for heart disease, and especially where LDL cholesterol is above 130, when we see a lot of statin interventions below 130, right, trying to get down to 70, we are missing, 80% of, and all of this stuff that's going on here, including exercise. If we just get people moving their bodies more often, and certainly if we help, optimize diabetes and pay attention to blood sugar, and then of course the whole metabolic syndrome and factors around clinical obesity here. Smoking not to be discounted, of course. So I grabbed this because I thought this was so important. Here we are, 2019, got the American Heart Association. This is from an accepted manuscript. I believe at this point it's been published, but I pulled it from when it was accepted. And what we're looking at here is within the top 10 take-home messages, you do not see statins as the only or the top 10. And in fact, what we see is how important it is, diet, paying attention to activity. For adults with diabetes, how do we look at all of those pieces, coming together? How do we, of course, take people through tobacco use and make sure we're paying attention there? And really only in one, maybe two places of recommendation, even looking as high as LDL levels of 190 or above, and those with diabetes. So depending on, do they have one risk factor or multiple risk factors, do we then get into a statin discussion? So one of the points today is to help your patients, and in a way as a marketing tool, to debunk and help support them understand that while a statin may be a tool, it is not going to be the solution, and it's not part of even the primary solution for the majority of patients in prevention. And I think that's going to be something that is so critical and such a great opportunity for you to provide in your role as the healthcare team member. So when we look at how we should treat heart disease, we know one way that heart disease is being treated with statins, but we've got all these other components, the diet and lifestyle, right? And I thought this was a really great interview. I think this was in the New York Times. I know it was in the New York Times. Love the work that they're doing, and Dr. Stamfer, awesome in terms of this. And one of the things that I think is so compelling is the information about the Mediterranean diet. Not that anyone has very clearly defined even what the Mediterranean diet is, but we know what's not Mediterranean diet, right? And so we'll dive a little bit more specifically into that. But at the end of the day, the fact that there is a dietary lifestyle approach that has the same ability for health, heart health improvement that is on par with a statin medication says to us, not is it an either or, but we darn well better start with diet and lifestyle for everyone, and then make a decision that there will be times that people need a statin. And one of the case studies that I didn't include in here was the woman who needed to stay on a statin, and the work that we did with her with optimizing digestion and actually really focusing on optimizing her inflammatory response and getting her off of diabetes medication, but keeping her on a low-level statin, and then of course adding in CoQ10. We saw that, and what I had to work on with her was that she just felt like a failure. She felt like I've had my weight loss surgery patients express to me where they feel like they don't want people to know they've had weight loss surgery because they feel like they're failures if they need to use that. We should never judge somebody if we have identified an effective tool, but we should definitely be in the business of helping everybody get and stay healthier using what we know about diet and lifestyle. And so I love seeing clinicians start here, and certainly I love the media actually covering that part. Okay, that wasn't a judgment on the media saying, actually, I'm excited that the media was actually covering it. Okay, so what does a healthy heart need? So we have to think about this in terms of the overall heart. And what we have to remember is that the heart is this whole system, right, where it's bringing in the blood, and it's exporting blood, and we're taking in nutrients. It's got all this stuff going on. And so what we know that what a heart needs is a whole bunch of nutrients. We should never be in the business of saying, like, I know it makes for a great segment, hey, these are the top 5 foods, or these are the top 4 nutrients, or any of those pieces. What we know is that the heart actually needs the body to get the nutrients it needs to run better. But if any of you have ever been on any of my webinars or podcasts or any conversation, you know that I will start off not there. Every healthy heart begins with healthy digestion. Your heart can't get what it needs without better digestion, because digestion is going to be responsible for absorption, for distribution, for elimination, for inflammation, all of these different things. And so, of course, what a healthy heart needs to run better is better digestion. Now, your genetics are also going to affect its ability. That's why it's crazy that we don't have behaviors and risk factors. We don't have genetics as a risk factor, right? On Thursday at this time, I'm going to be talking with Amanda Archibald about MTHFR and how popular that genetic mutation has become. And that's great that we have this awareness. But this idea that like it's solved by just putting people on a methylfolate or a methylcobalamin, a B12, is such a flawed concept. What we're starting to learn with genetics, and I'm not sure how you actually pronounce her last name, but Dr. Denise Prius, from who's over in Australia. I was listening to her great interview on MTHFR and folate, and it's like, we don't know all of this just yet. But what we do know about genetics is we know that our homocysteine levels are going to play a key role in heart health. We know that folate metabolism and methylation is, includes nutrients like riboflavin, like B2. We shouldn't just be paying attention, for example, to looking at MTHFR and caring about our folate and our methylcobalamin. Or what about if you're getting in folate or B12 or both of those in the right amount, but you're not getting in enough B6? Well, we know our genetics are going to be a factor there, just like our genetics that help us understand how we metabolize caffeine are going to be important. Just like our genetics that help us understand if we actually absorb and convert vitamin A into a usable form. So the information we're learning about genetics is super important to this whole discussion of heart health. And then an additional piece, and this just drives me crazy in today's world. You guys can give me a high five or note it in the question box if you're there with me. But yeah, I mean, it's just crazy that we fall in love with one nutrient, and as a result, we're meant to discredit another. So we're meant to love omega-3s and hate omega-6s, or people are told omega-6s are bad for them. I had someone send me a note saying, I can't believe you use sunflower oil in that recipe. It's so rich in omega-6, and you need omega-3s for heart health. And where do you get your information? And oh, by the way, how do you even have a license? I can't believe, literally, that was their email. And I was like, so I'll tell you. And I started to go through, and I was like, let me just answer. And we actually had a fantastic conversation. And this individual is now saying, oh, I understand. It was just that we were getting in too much omega-6s, and a lot of omega-6s are not better for us. But that balance of omega-6 and omega-3 is so important. And likewise, within omega-3s, there are different, omega-3s, EPA, DHA. One is not just better for the heart and one better for the brain. And oh, by the way, maybe it's HPA that activates EPA and DHA. So maybe we need to actually get all of those in a better balance, and not just think, oh, I'm going to just EPA my way to better heart health, right? Minerals, we've loved calcium for so long. We now know calcium, when misdirected or undirected, when it's lost its escort service and it doesn't have vitamin D and it doesn't have vitamin K, and we're not getting enough magnesium and it goes undirected, it can become that arterial plaque that's so dangerous for us. So is it in a better balance, with magnesium? And what about potassium and sodium? Well, we know, just like removing bad, quote unquote, bad fats, it doesn't get us where we want to be health-wise. We actually have to increase our intake and get in enough of the good fats. We also know that just removing sodium doesn't get us where we need to go. Even though the numbers, the daily value, the AI for potassium has come down, thankfully, from 4,700 milligrams, which I don't know how anyone was getting that in on a daily basis, but we're down more around 3,000 milligrams. But remember, a banana has about 350 milligrams. So, I'm deep in this because we were just revising our potassium evaluation and our potassium menu to make sure that they're tools that are going to help, guide people to these new AIs. But it's still like, are people getting in enough potassium? If you don't have enough potassium, none of this works. Those B vitamins that you're focused on getting in, they don't get in, they're water soluble. They don't go with the water into the cells where they need to be to work. So how do we make all of that work? We have to look at better balances of nutrients. And of course, what I'm going to talk about is better balance in a total capacity of those nutrients, not just saying like, what am I getting from foods? Because we're taking in nutrients from beverages, we're taking in nutrients from medications, from skincare, from all sorts of things at this point. And then we also need clean pathways. We need to make sure that we don't have that interference. So what's going on with unhealthy levels of inflammation or chronic low-grade inflammation? What's going on with sugar? Is it the sugar that we're taking it in, or is it that the body doesn't have the nutrients to bring the sugars or the right the right hormonal metabolism to bring to escort that sugar into the cells where it can be used? And we've talked about calcium and its role of deposition there. I might add another thing here, that we also need to make sure that the body, in order to get what it needs to be avoiding. We need to not have a lot of things running interference with its best efforts. For those of you that joined me for my last conversation, it's over on YouTube, about CBD, one of the challenges, especially with some statins, is that CBD is going to compete, and you know what? It wins. It womps on the statin, and it gets preferentially treated. So maybe the statin isn't as effective. Well, the medical practitioner who doesn't know that your patient is taking a statin, is consuming CBD, just sees that the statin is no longer working. So they increase the statin, right? And then somebody comes in with muscle pain and they're saying, oh, I'm not doing well with this, et cetera. But maybe it's actually that they added CBD, and maybe that the CBD taken at a different time, or, in a different construct, or with a different statin, could be more effective for their overall heart and their overall body to run better. And so that's why our CBD guide now includes all the questions that practitioners and their patients should be answering, to make sure we're on the same page if we're drinking, eating, putting on CBD, or doing any of the other things that people are doing with it these days. All right, so how do we actually know? Well, there are a lot of assessment tools. I am so excited about this area of genetic testing. I'm learning a lot, Ginger Hooten, Mary Purdy, Amanda Archibald, I've mentioned her. I'm learning so much from dietitians who are really deep in this field and are doing the testing and helping me understand where we know enough to make actual recommendations, and where we might know enough to just know something about somebody but not really be able to make a better decision about that part. We love sleuthing, right? And so we got all these tools. We have food recalls. We've got ways that we can check things out. We even have the chronometer or the chronometer, however we pronounce that part, to see what nutrients are coming in by way of food. But the issue is we're getting in so many nutrients not from food, or the packaged food, the nutrients that are being added into packaged foods are changing at such a rapid pace. None of us can keep up with that part. We're constantly having to source that information. And so there's a lot more that, there's a lot that we've got on here. I don't highly value BMI, but I know it's a tool that we have. Lab testing, obviously it's a great tool, but it's not going to tell you about magnesium levels. It's not going to tell you if your cells optimally get enough potassium. It's not going to tell you if the body's getting in too much calcium as it compares to that potassium, to that magnesium. So we've got to do better than just the existing assessment tools. And what we're really looking at, we have to ask the primary thing that we've got to do for every client. For us, this is our unique area of opportunity. You should be screaming wherever other people are screaming that you do total nutrition assessment, and you should spell it properly, which I did not do here, but you should be screaming about that part, because there are tons of people out there ready to compete with you, to tell you what the right answers are, to get patients to tell them that, or clients, that did you know kale's good for you because it's got B vitamins in there, or did you know this, did you know? You're like, that's great. That's what you should do, because that's what your training provided for you. What I'm going to do, because my training has provided for me, is I'm going to do total nutrition and lifestyle assessment. And I'm going to offer that. I'm going to be the quarterback and offer that to all the other healthcare practitioners, so that we can create the best, most personalized recommendations for patients. And I'm going to consistently check in on how that is evolving. That's your unique area of opportunity. That's what I want to talk about in this assessment, because that is why at this phase, I see very few patients, but it's why over the last 5 years, I've been able to command very, very high fees for my patient, my individual patients, and also for my group patient programs, and to be able to turn around and say to practitioners, you want to refer to me because I am going to make you look so good in your job, and I'm going to make your job so much easier. You all are doing that. I just want this to be easier and more efficient for you. And I also want you to have the megaphone that helps you communicate that to everyone. And that's what we're going to do, thanks to Joe. So Joe is just like, I think, so many of the people that you probably meet, where he literally, emailed me singing a song. I just want to be statin free, free to be, I was singing it in the background, right? he's nervous. You know, he knows he has a family history of elevated cholesterol. So when he went in and saw his doctor and his cholesterol was high, he was like, okay, like, I get it. My cholesterol is high, right? Interestingly, he was dealing with a different situation at the time, and I'll come back to that in a moment. But he saw his doctor at one point, and his doctor said, all right, your cholesterol's high. He did nothing on that part. But then when he went back to see his doctor and his cholesterol was high and his blood pressure was kind of up, life was really stressful for Joe. He's got some stuff going on that I found out through our consult, and we were talking about that part. And so this was the time where the doctor said, like, there's no business, you know, we're not messing around at this point. We got to be all business, and we got to jump in on that part. So he said, here are my labs. So I'm sharing this with all of you because there's no way these were his labs, and he said that he had high cholesterol. So what we ended up finding out was these were not the most recent labs. His LDL had gone up to 140, and that was where the doctor had just said, you know, this time there's an intervention. His doctor had run a CRP. If you don't know what any of these are, just hit me in the question box and I'll go through any of them. He had because of family history, he had a lipoprotein A test. It was normal, so he did share that with me. And he's in pretty good shape, pretty low on body fat. If I had just looked at BMI, and then I would have been like, oh, I bet this guy's like some sort of walking metabolic syndrome. I'm going to help him lose weight. I'm going to do, you know, all this other stuff. And in fact, the doctor said to him when he said he wanted to see a dietitian, I don't think she's going to help you at all on your cholesterol, but maybe she can help you lose some weight and we can get your BMI to a normal level. So to which I answered, and I actually did not answer this to the doctor, like 16% body fat, like he's doing good. You've got to look beyond just some of these basic numbers, right? So he didn't want to take the statin. His doctor said that he could try nutrition for 3 months, but only 3 months. But he doesn't think that will work. And in the interim between seeing the doctor and seeing me, his wife had looked online. So he's been taking for a little bit of time CoQ10, a fish oil. And then he's also been taking calcium because he avoids dairy because it upsets his stomach. So that was good information. So that was the information that I had from Joe. So I sent him our heart health evaluation, the Better Nutrition Heart Health Evaluation, which I've developed with cardiologists, with the two authors. I don't know if you guys know Johnny Bowden, who's a certified nutritional specialist, and he and Steve Sinatra wrote the book, The Cholesterol Myth. I think it's a phenomenal read and way, way, way ahead of its time. And then also I worked with two dietitians as well in the development here of this evaluation. So this evaluation, he went through and he fills it out with me, and I wrote in the notes, just X out if there are any things that you don't eat or you avoid. We'll get into that discussion later. So if you see things X'd out, then that's from him, and underlined, that's also from him as things that he does consume. So I learned so much about him when I get this, and I always recommend, if you've been on any of my webinars before or been in any of these trainings, you'll know that I recommend them coming in 72 hours ahead of time so that I have time to dive into this. So super helpful for me. On the base of it, I'm like, yay, greens. Okay, he's not having some starchy vegetables, not the end of the world. Okay, he's really only getting in spinach of the nitrates, but the plant nitrates, but that's good to know. All right, what's going on over here? He's eating berries. Yay, that's awesome. But he's not having any of the fruit. Oh, good, like no fruit juice. So we'll look at that part. And then he is having olives and avocados, not having acai, and he's having these sometimes. So that's helpful for me to know. And then I get this. So I'm avoiding grains now and most fruits, and we'll come back to, you know, what I discovered there. He's eating beef, bison, and turkey, and that is something that he's having all the time. And then he's never eating, we talked about, he said, I'm not eating grains, so now apparently not eating beans. He had mentioned that he was dairy-free, but also here he's saying that he's always eating it, so I just need some clarification there. Using non-dairy or dairy replacements. I'm not really big on the fried food, but I need to find out what sometimes means to him, because maybe sometimes is some more times, most of the time in the week. Not having salmon, sardines, or anchovies, cod. My voice there will give some acknowledgement of what I think of that, but he is choosing to have some of these others. Sometimes having nuts and seeds, sometimes getting in the oil, sometimes on here. Caffeine, absolutely. Not choosing energy drinks, drinking water. And overall, nothing here looks too significant, although, you know, I definitely want to pay attention to inquiring a little bit more, but it's providing me some good baseline information. He had mentioned the supplements, so I saw those appear here, and then is not taking any of these others, so that was helpful information. I just wanted to get any clarity on is the calcium, what kind of calcium and how much, and so of course I would be asking about that. My normal intake form asks people to provide, they use the food journal, better nutrition journal, and then they also provide information for me, take photos front and back of any supplements, including fiber and protein powders that they're using. So that's included on here. And then we also find out information about the sources of his stuff, and it's kind of like unhelpful or just it's just there for what it is, and nothing is standing out, I should say, in this part. And then the supplements, he doesn't know about any of the quality information on his supplements. They were just, as you recall, purchased by his wife. So we'll dive into that part. Now this area, section B, game changer for me, absolute game changer, where I'm able to find out on this front so much about what he is worried about, what he is doing. So this guy is working out, he is stressed out, he feels lonely, he's not sleeping, he's not meditating, he's not breathing, he's not, all right, we get it, right? So I'm getting a ton of information there and I was just actually talking to another dietitian yesterday, and I was saying, sometimes we focus just right in on the foods and the supplements and the total nutrition. This is the money section for this guy with me in terms of what I'm going to be able to do and what we were able to do. So from that, I was able to get a better roadmap for my session. So one of the things that I love about better nutrition assessments, about these evaluations, and recall, we have two different versions now. We have the practitioner versions, which only ask the questions and they don't provide the recommendations that our experts have gathered on the form. Those are only available if you purchase the Better Nutrition shop of tools. But everybody, including patients and individuals, can can get the evaluations that have our recommendations and have, hyperlinks and things like that to the Better Nutrition program, so that if a patient or an individual is coming directly there and purchases the tool, they will get that. And also, I keep it in the shop of tools for practitioners because sometimes we want to review what our colleagues are sharing about what they would assess. So like I just went through how I assessed his heart health in terms of what information was in the recommendations. And I learned to look at all of that stuff based on reading those recommendations from the experts, but I don't necessarily need to send it off to my patients, right? But when I did and got all of this information, I now have a better roadmap for me. What does this mean? Hyper efficiency for what I'm going to do during our session. And also, it actually allows me now to plan for how many sessions I'm going to recommend, what's the spacing between them, what are some of the things I want this patient to do. I will ask them actually in this session, are you going to be willing to do X, Y, or Z for me as a follow-up? And if they say no, I'm not going to convince them otherwise. Thank you for your honesty. If you're not going to do X, then I'm either going to need you to make sure you do this, we're going to have to get it in this way, or I can't guarantee the outcomes that I would like to see have happened for you. And when you say that, it's usually pretty convincing, but it may still not be enough to convince someone, right? Okay. So the primary thing that I learned from this actually was his digestion is not running better. I got a couple of hints all throughout, but in that last section, I'm gassy, I'm taking, I'm all of these things. I cannot get his blood pressure. I cannot get his his sleep. I cannot help his heart health. I cannot help his cholesterol. I cannot help him emotionally or physically or anything until I get his digestion to be better. And that is going to be the foundation of this conversation. You came in to talk to me about cholesterol. If you are not pooping, nothing, no medication, no nothing is going to eliminate that cholesterol from your body. So nobody should be on a statin and not pooping, but nobody should be doing anything and not pooping. We got to fix that part, right? We're also going to talk about, and I want to explain how inflammation works in the body and how we can actually address it with better nutrition and where we want to kind of pull on the levers, because he's doing a lot actually already that could be promoting healthy inflammation. We just want to help add on to that stuff. we're going to talk a lot about the role of calcium because that supplement, he was taking 500 milligrams of calcium twice a day. So what I wanted to do was, first of all, go over and review his food. So we'll do the calcium evaluation and then show him where he can get calcium from foods. And then let's also see what is a bone health risk for him. He strength trains all the time. He's in person, and from the information that I had, he's pretty good in terms of, I don't look at him observationally. Of course, we have to know about things in your youth. Were you on asthma medications? Did you have good nutrition as a child? There are other factors to look at in terms of key bone building years. But I don't think we need that. My estimation was that we could probably move this over to food. I didn't have the vitamin D information that I needed. And then this was really important. We have to talk about the role of fiber and magnesium in all the foods that he's avoiding these days. So if he's going to choose to continue to avoid those, that's not my decision to make. But I also told him point blank, your body still needs these nutrients critically. So how are we going to get them in? We're also going to talk about stress and its overall role. And actually the stress conversation is going to come up top with the digestion conversation, but it's going to be really important. I also need to know about his exercise and his recovery, because too often we're keeping the body in a stressed out state, and a part of what we're doing is our actual physical activity is contributing to that part. So while the exercise can be so amazing for us, in this instance it actually may be exacerbating underlying challenges. We've got to make sure that we're optimizing that connection, and I may even refer him to somebody to talk about the, or for me, want to talk to his trainer if he's got a trainer on that part. And then, as I said, the money spot in here: loneliness, sleep, and breathing. I've got to figure out what's going on, because this has more to do, other than digestion, this has more to do with everything that he came in with than any single food that he's eating or not eating. And then I wanted to share with him the results and the information that we went through in terms of the dietary approaches that can help even on par with the statin, and actually provide him some tools that you will see in a bit that I am open to sharing with his doctor on his behalf, to help him understand what we could do for not just 3 months, but what we may do for 3, 6, 9 months, a year, if we're seeing consistent commitment and compliance from the patient and outcomes are starting to go in a favorable direction. Okay, so Joe's Better Health Plan, and over to the right, you'll see the different tools that I used and also provided to him as part of his Better Health Plan. I'm doing his Better Nutrition Digestive Tune-Up. Now, I have a program for that. I used to just run this for my patients, and with the launch of the Better Nutrition program, I decided to offer that program to practitioners who are using the Digestive Evaluation. It's the only tool that you need to use. Many of the other ones are complementary. And we have that available, both the slides and we also have the recording, if that is something that it's a rip and repeat. So basically think of it as a white label program. If you want to leave here today and then offer this 30-day program to your patients. I actually was just talking to this nurse practitioner who has a huge practice, and we were talking about the fact that she's seeing all these people and she wants to put them on tests and start to work with food allergies and intolerances and all this other stuff. But she's like, Ashley, every one of somebody who's coming in needs to be doing this digestive tune-up program. So she's now actually putting them on the program, and she's doing groups of it with a health coach in her practice and with the doctor. They're doing that before someone comes to the first appointment. They're doing that tune-up. And the primary reason is that this tune-up is very clearly not an intervention to treat and heal digestion. It's just to tune up digestion so that the practitioner, when we now look and use the tools, are we going to do food allergy testing? Are we going to look at your cholesterol levels? Are we going to look at any of this stuff? We can understand what we're doing better because we know that the digestive system is in a better position. And oh, by the way, if the digestive system is not in a better position, we know that's where we have to focus our intervention. So I'm going to do that for him, and that's my recommendation for him. And we talked it through, and I said, look, nothing else is going to work. And he said to me, you know what? Part of what's going on for me is that the more that I stress, the more that my belly is aching, and I'm so worried. I was worried that I was having a heart attack, and he's like, I was thinking it was my cholesterol, but it's actually some acid reflux going on. And he's like, and I'm not sleeping, and then I'm thinking that I'm having a heart attack. And I was like, let's all breathe, right? So then we get into stress management and we teach him the 4-7-8 breath. And we sat there and we actually did that in my office. We went over the 4-7-8 breath. We also went over a couple of different meditation apps. Wow, my spelling, sorry guys, I just did not do a good job on this. I'll clean it up before I send it to you. Mediation is great. That wasn't what I was doing here. Unfortunately, that is actually an issue in the relationship piece. But we have a meditation app that I introduced him to. And then we also talked about the role of magnesium. And so we did a magnesium assessment because we wanted to look at that counterbalance of magnesium and calcium, and looked at foods that he's willing to eat as a source of magnesium, which interestingly for him, he's open to cacao and hemp just because they're lower in carbohydrates. So we got into those. And then he was open to a low carb version of Mediterranean. So we talked a little bit about what I wanted to do for him is time the use of his carbohydrates. And I wanted to do that for a couple of reasons. One, I wanted to make sure that he has enough energy to support both his work and also his workouts. But the other part was I wanted to see if we can help his digestion and make things just easier in the evening. And so we were looking at, what the option is there. But I also want to make sure he's not on a high protein or a high fat diet. So we talked about how are we going to expand the use of all of those different vegetables and get better balance in there. And then of course, focusing on potassium rich foods. His blood pressure kind of high. Most of that is actually, I think, going to be resolved. I was speculating when we work on the digestion and the sleep and the stress, etc. But none of those, not getting in the potassium rich foods, many of them are carbohydrate laden, so he was avoiding those. So we had a conversation about potassium rich foods, not supplementation at this phase. He was not willing to change and increase fiber intake from the grains, the beans, these sorts of things. So we went to a fiber supplement. And I actually had 3 different ones. There's one protein powder that had a fiber supplement in that. So that actually is proving a tactical tool for us on that part. And then we also looked at just the role of using things like psyllium and hemp and chia seeds and some of those things. He's going to be tracking with the Better Nutrition Journal, and specific to his tracking, if you guys haven't seen, happy to share, but you don't just track the food, you're tracking total nutrition in there, but you're also answering questions about how do I feel when I wake up in the morning? What did I take today? And then also, how did I do on my exercise? How did I do on these other things? For him, I wanted a stress number for the day to kind of note how he's doing so that we can start to follow that part. I also wanted him to get actively involved in measuring his blood pressure, and we needed to get that vitamin D test done. And then he needs therapy. And he actually was saying he needs therapy. He's like, I know I need it. He's like, it has not been. And interestingly, the issue has been he's going through a horrible work breakup. And so that's why I laugh at the mediation thing. And the work breakup is causing just massive issues at home because he's feeling judged when he gets certain recommendations or when he's not doing certain things and that other part. So that was, something that I said, like, doesn't matter what we do with your diet, but it does matter. I can put you on a digestive tune-up program, but if we don't work on this part, your digestion's still not going to run better because your digestion is, as we know, like with serotonin and other pieces, so receptive here. He gets drug tested and was just really not interested in CBD. So you'll notice the CBD conversation here is not part of, CBD is not part of this conversation. With a different patient, I may have introduced it even as part of the digestive tune-up program. I also will spell out for his physician that I want to implement his nutrition plan, but we are going to do that 90 days, we're going to implement his nutrition plan right after we do the digestive tune-up, but I don't want to retest his cholesterol for 90 days until 90 days after he's completed the digestive tune-up. So I want those 90 days to see how the nutrition plan that we were working on. So essentially I had him on a low carbohydrate Mediterranean diet. We added in the first round are going to be the supplements that he needs for the digestive tune-up. And I actually pulled off almost all of the other supplements, especially the calcium, and didn't have him on that. I was comfortable with the fish oil and the CoQ10. Although he wasn't on a fish oil, he was on an EPA supplement. I changed him to a wild salmon fish oil, so he got in all those omegas. And then the CoQ10, he was on 25 milligrams, and I upped him to 100, and I think it was, did I up him to 200? I'd have to go back. It was either 100 or 200. I did do 200, and I had other thoughts for that, just in terms of he had a history when he was younger of smoking. He had given up smoking, but he did have a history of smoking, and I want to make sure that he's getting antioxidant support in that space as well. I didn't include in here genetic testing. I would be very interested. His homocysteine levels are not remarkable, so comfortable on that part, etc. But I would be interested in as a next level referral, but I also didn't want to overwhelm him. So at this point, it was, here's where we are. And oh, by the way, can I have a conversation on your behalf or share a document and I like to use Google Docs because we can all edit in and comment in, and everybody can see the comments with your doctor, with your therapist, and with your fitness trainer. At the time, he was actually looking to train. I think he was changing trainers. I think I may have actually given him a recommendation of somebody that I had worked with on that part as well. Okay. So just to recap, these were all the different tools, assessment tools, and a couple more that I had mentioned on that part using. So, using the heart health evaluation assessment, we're going to do the digestive tune-up program, which includes the digestive evaluation, the guide, the magnesium evaluation and the calcium evaluation. We did those. I had him fill those out and send it over to me instead of, that was a spoiler, instead of doing that in another session. And I ended up billing him for a monthly fee as opposed to an individual consult fee, because I was going to have calls with his practitioner and we were going to do this stuff, but it was a better use of his time to just fill out these things and send them over to me than for us to do them together in a session. And we actually didn't end up doing the sodium evaluation, but we did move over to the omega-3 because I wanted to point out to him, I wanted to show him with his commitment to low carb, and I got him to low carb off of very low carb, with his commitment there, I really needed to make it clear, and I kept hammering, and you don't see the fiber one here, but I have the fiber and calcium evaluations that we also did. I needed to hammer into him that there are just nutrients he's not getting and show where he could be getting those, where what he's ruling out. And that's where our other menus, our calcium menu, our potassium menu, we went through and we circled low carb options that would still deliver these nutrients, and how he would get those in. And those were valuable tools for us to help build his choices for his menu planning. So yay, this is me fly fishing in Alaska, woohoo. So very happy on that part. By the way, total sidebar, but like I feel like an extra rock star whenever I'm here, because through just an odd set of circumstances, I'm wearing Marielle Hemingway's, and I still own her waders that were purchased for her for up in Alaska with us. So I think like I feel like the look here is like, just picture this being Marielle, because when I see this video, this image, I just think that I am Marielle there. So that's what's going on if you hear me giggling. All right, so today still, because Joe is still a patient of mine, he's enjoying Better Health Powered, following his better nutrition plan. And, he has been very low carb at times, and I would say he's low to moderate carb at this point. Why is that relevant? It's not about me winning. I have nothing against carbohydrates. I'd love to see him in a moderate, a more balanced carbohydrate place. But what I do know is Joe is getting the nutrients that his body needs. And my job is to help him get that from Total Nutrition. His doctor continues, despite me saying I'm no longer taking patients, his doctor continues to refer me patients. Some of you, if you're in our provider referral network, may be getting those patients or may have already had me reach out and be like, hey, I got another referral. A lot of VIP patients or people who assume or consider themselves VIP patients from Los Angeles. The nice part about that is price is almost never an issue if you deal with other issues. But we make those referrals. And the nice part is a lot of times now the doctor is saying like, hey, I'm going to recommend a statin, but if you want to try nutrition, I've got this person. And then, there's the referral. And that to me is like the greatest compliment and the biggest win. And Super exciting to me, obviously, as CEO of the Better Nutrition Program, but more exciting to me for the role of where we can take therapy today is that his therapist in her practice, and so their group of therapists now use the digestive and magnesium evaluations in their practice. I cannot tell you, it's like when a gastroenterologist and a dermatologist fuse into, I'm always like, Wonder Twin powers activate. Wow, the dermatologist is asking about the digestive system. Oh my gosh, we're going to do such great things for this person's acne or eczema, right? When a therapist is now engaging and asking questions or saying, hey, can we tune up digestion and magnesium? Or if you're not doing well, she has a cheat sheet that she uses now. If certain boxes are checked, she refers over to dietitians. Again, those dietitians often are in our provider referral network and getting patients through that because we know we've got to tune those things up. She can't put somebody on an SSRI or just say to someone, hey, come in and talk to me while you feel super bloated or you've got acid backing up or you didn't sleep last night or you haven't gone to the bathroom in a couple of days. She knows in order for, and her practice group now knows, and I've done a webinar for them and had that conversation where it's like, hey, if you guys do this part, you're going to help your patients leapfrog into better outcomes. And that's that part, that we're working on with them. So at the end of the day, what we know is, of course, as practitioners, we need to be doing this kind of assessment. And yes, the scale matters. And yes, it's helpful to know all these other things. But if we don't know the total nutrition up front and the lifestyle components, we will not make better recommendations. And in fact, we may just have the order of our recommendations not come in the right order. And as a result, things will not work. It's like putting a probiotic into a leaky gut. That's not going to work. You got to get the leaky gut. You got to plug those holes, right? We're putting it into a super acidic environment. We got to help that, or taking it at the same time as an antibiotic. We've got to help resolve these things so that we can have the order as well as the complete picture and put that whole recommendation together at once. So this is the part where the screen just goes away. Just kidding. This is the part where we're going to dive into questions. So please share any of the questions with me. I want to remind you why I'm so passionate about these tools. You guys, I could have kept going on in my practice and doing what I was doing in California and DC and everything else, but I kept hitting this wall, and that wall is that doctors, dietitians, all of us, we're not getting the outcomes. 50% of Americans are struggling with diseases related to their cardiovascular system. That's not better. And the issue is that we have so much information and all these different tools, but we need to figure out how we can be efficient because we don't have all this time with them. And we also know our patients don't have all this time. And the way that we can do that is by efficiently assessing and getting that total nutrition information. Now, the only way to get the practitioner evaluations, I mentioned that already, is if you're getting the shop of tools. This is the part where we're going to talk about marketing. It is so ridiculously easy to get referrals. And I know that sounds really mean as a person who has been in that space before trying to build my practice. But if you are not getting the referrals that you want into your practice, and by the way, what I mean by that is people that either can afford you or that you take their insurance or whatever it is, the right kind of referrals. If you're not getting them, you're not using a better referral generating marketing plan. And what I just showed you, you just need one case like this, right? You could even take this case and show a practitioner how it works and say, I'm doing this now. I'm doing these assessments, right? So if you're doing total nutrition assessment, you say, you know what, use that other person over there for your Instagram photos, or use this other person, in your office to do intake information or to execute what your recommendations are. But use me as your quarterback. Bring me in as the person that is going to do that total nutrition assessment. That is how you get referrals. And by the way, anyone that you're talking to, say to them, the reason that I cost more is that I do total nutrition assessments. And I do that. I'm gonna use those tools. I've invested in those tools. I'm not asking you to buy anything unless you want to have them buy them instead. It's totally up to you as a business model. But you should be doing this for referral generation. You should be saying to doctors, hey, can I come in once a month And for any patients that want to be here or virtually, invite them to a webinar and run them through this webinar, obviously a patient version of it, right? And share with them, because I guarantee you most of them don't want to be taking a statin drug. And said differently, most of them are terrified that they're taking a statin drug and that in the hope that it will prevent a heart attack. And we know 50% of heart attacks happen in adults with quote unquote normal cholesterol, healthy cholesterol levels, and many of whom are on statins to achieve that, right? So they're insecure. They have every right to be insecure. You're their better solution. These are also ready-made lead magnets. So we're comfortable at the company for you to use them as a way to, if you've got a system like we use Drip or Lead Pages or one of these, or if you just want to say in your Instagram posts, like, did you know, like, a statin isn't the solution? Hey, I've got a quiz for you. And then if you've purchased the quiz, you can use it with anyone, right? The only time you need to get written permission is if you're doing that through, if you're wanting to include it in a course that you're going to sell or that you're going to be using. I just want you to have that written permission because I expect at a time to not be running the Better Nutrition program, and I want to make sure that that information is in there into perpetuity. So we do it as a written form. So there are 4 amazing reasons. And the 5th reason is, don't go so fast, I wanted to do a sale. So I wanted to do a sale because I'm celebrating. We've had just the amount of practitioners who are purchasing our shop and using these tools. I am so excited. I'm really excited right now for a couple of leading universities across the country with their integrative medicine programs to be looking at bringing these in, and we're having those licensing and negotiations and all of that stuff. But I've been listening to all of you guys. And one of the things that you said to me is, I want to have these tools have less hyperlinks, less Better Nutrition promotion stuff. It wasn't promoting Ashley Koff RD, but we don't want to promote another nutrition thing. And so we've removed those hyperlinks and we've updated all the tools, not just the potassium evaluation. We do this every year. We update in case things have changed in the nutrition world. Ha ha ha, they always change, right? So we've updated all of those, but we've created these practitioner versions, and now they all have a space for you to enter your recommendations. They're editable notes sections for you to put your information in there, for your patients to put any specific information in there. If you want to put links and promos of your own in there, you can put those in there. But the only way to get those practitioner versions is if you get the if you get the whole shop of tools. And the reason I'm running this back to school special is, one, I'm obsessed with back to school supplies, and I still, I think I miss being able to buy back to school supplies. I don't have kids for school age for buying back to school stuff, and my business, I don't have back to school needs, although right now I think I'll probably go buy something, and I just love back to school supplies. Anyway, a sidebar. The reason I'm doing it now is that we're just launching those practitioner versions. And so anyone who purchases before the 1st of September is going to be the first group that gets the practitioner versions. And you're going to get some special offers with that, including some conversations with me and with my team. And we're going to go over, because I want to know if they work in the form that they're in and all that stuff. I want to continue to get great feedback from you guys and use that part. So that does bring us to the end. I want to thank you all for joining. I really, I don't see any questions in the question box. I know that there's been a request to get the slides in a PDF form. But now if you have any questions, I'll stay on for a couple of minutes and answer them, especially, and Muriel, I see your hand up. Can you put the question in the question box? I think that's the easiest. I'm not sure. I don't think I can, or maybe you're just saying high five and saying thank you. That might be the case also. But Muriel, let me know if you have a question. Oh, wait, there you go. What is the next step? Great. So the next step for you is we have over at the Better Nutrition program, you can head directly to the shop and you can go ahead over and purchase the shop of tools. Thank you as well, Meg. And then you and I will have a call and we'll go through how you're going to use them in your business. And you just want to make sure you enter back to school at checkout. If you are somebody who is instead, you're like, hey, I want to do that, but I just have some specific questions about my business, I can also set up a 30-minute call with you on that part. I have a Calendly for that. You can just email me at ashley@thebetternutritionprogram.com. You are also going to get this tomorrow, but just keep in mind tomorrow's the 28th, and we only have until the 31st for this 15% off, which is over $200 savings. And remember, when you purchase these, it's a one-time purchase for you to be able to use it in unlimited capacity. So really, you just need 3 patients to bring on 3 patients, which marketing wise will be able to, easily help you achieve those pieces. And then you've already made more than I would expect in most instances what your out cost is. But hopefully that answers that for you, Muriel. And if anybody else, if you have other questions that come up, we're going to send the slides to you tomorrow, including the PDF. Ashley Frank, we'll send them over that way to you, both as a video so you can hear this, and also the PDF tomorrow by email. So please make sure that you look for, and it said this in the sign up, hello@thebetternutritionprogram.com. And if you're sending an email to me, it's ashley@thebetternutritionprogram.com. My team funnels me the ones from hello at though as well. Yeah, I mean, look, you guys, there's so many Joes that are out there. I just got back from vacation in Maine and I saw my friend and we're sitting out on his beautiful, I mean, the guy has everything in the world like that you could imagine. And he's sitting there and he's like, my doctor put me on a statin 6 months ago and I'm miserable. And he's just not open to another conversation. And I was like, okay, I didn't come here to do a consult. Number one, it's my vacation. But second of all, you are so not alone. And let me connect you with a practitioner and I went ahead and did that. And I actually think that practitioner may be on this webinar today. So thank you very much. I will not out you on that part. But it's like people are like, it's not about the money. It's like, where are the practitioners that are going to do this for me? And we need to be doing a better job. And I'll just step even higher onto my soapbox. If you are a dietitian, we need to do a better job about communicating this and not communicating why dietitians are better than health coaches. I am so it's just too much right now for me when I see these whole things of like, I'm a dietitian, I have a license, or I'm a dietitian, I went to school and got this education. Honestly, I'm just going to be really blunt. That's just you talking to yourself and to others like you and saying, aren't we great because of this part? That is not the case. Your clients, the prospective clients out there want you to tell them this. They want you to connect and say, hey, I know there's a better solution, a better option right now for you. And that begins with me assessing your total nutrition. And yes, my dear Dana, I will of course refer you. I love referring to you. And so, I just send people over to our provider referral network, which, by the way, if you don't know what I'm talking about, head over to our website, which is undergoing also a total makeover. It'll be new for September, hopefully September 1st, maybe we'll say the first week of September. But our provider network right now is listed under the provider resources. It'll move under the practitioner resources, and the network includes practitioners who are already using our shop of tools and have purchased and are using the digestive or other tools as well. And thank you. You love dietitians and health coaches. Back at you. We love you. And oh, Dana, there's so many things that we could talk about, right? So anyway, I just want to thank everyone so much. One other thing I wanted to add as I'm just wrapping up and chit-chatting with you here is that I do have a Facebook group for the Better Nutrition Program. It says Better Nutrition Affiliate Program. I'll rename that at some point. It's just not so high on my priority list. But I'm also doing office hours with these case studies on a regular basis now on Tuesday mornings. Of course, they're always going to be up there. So if you're struggling with a particular patient, or you want to know how using better nutrition tools could work, or if you just have a case study you want some help with, or thought it would be fun for us to collaborate on, send that over to me. And likewise, if you have something that you would like to be included in, or if you would like to participate in one of our webinars on a monthly basis and you're using better nutrition tools, then please also let me know on that part, because as much as I love doing this, everybody doesn't need to hear from me all the time. You guys are rock stars and better nutrition experts, which, oh, by the way, I define as being science-based, but also practice-based. And so for those of you that are doing both of those things, I would love to highlight you and have other practitioners learn from you and learn from your experience using better nutrition assessment tools as well. All right, everybody, over and out. Thank you for the hour. I'm so grateful to you, and expect your email tomorrow. Take care. I love you, buddy. Yeah.